The goal of this presentation is to explain the system-dependent variables of the 3x4 scanning quality checklist that should be used in daily musculoskeletal ultrasound clinical practice. Using this checklist will ensure that you scan your patients in a critical and qualitative way and that you lower the risk of false positive and false negatives. The system variables are the second point on our 3x4 scanning quality checklist. The 4 system variables to constantly check and adapt are the focus, the gain, the depth and the frequency. Let's go over them one by one. The region of interest should be focused. By focusing the region of interest, the greatest degree of clarity is obtained. Not focusing on the region of interest results in a less clear image. Although it might seem like the difference between focusing and not focusing is small, it has been proven in clinical practice that these small changes are in many cases crucial in deciding whether there is pathology present or not. An unfocused ultrasound beam leaves its source and continues at approximately its width for a particular distance before it starts to diverge. The region close to the source, in which the beam remains narrow, is known as the Fresnel zone or near field. This is the region where the majority of the incident sound waves converge to create the greatest degree of clarity. The narrower the Fresnel zone, the greater the resolution. The region beyond the Fresnel zone, in which the ultrasound beam has started to diverge, is known as the Fraunhofer zone or far field and is associated with poorer lateral resolution due to beam divergence. The focal point is the horizontal line on the screen that should be placed at the level of the greatest interest on screen. The focal point refers to the location where the ultrasound beam converges to provide the greatest level of clarity. In reality, the focal point is not a precise point, but rather a focal zone where resolution is high. When scanning an anatomical structure, which is narrow in the plane parallel to the ultrasound beam, the focal point can be set at the level of the structure in question. Every ultrasound machine will have some sort of control over the focal point, the position of which is indicated on the depth scale. This image shows the focal zones on the right side of the screen in yellow. The yellow focal markings are pointed out by the red oval. This alignment of focal point with the anatomical structure in question seems intuitive and will give good results. However, where most people get unstuck is the positioning of the focal point when scanning a structure that is much wider in the plane parallel to the ultrasound beam. For example, if it has a significant depth on screen. Intuitively, most people will position the focal point at the midpoint of such a structure. However, the focal point will correspond approximately to the deepest part of the Fresnel zone, and as such, any part of the image deep to the focal point will lie within the Fraunhofer zone with associated beam divergence and poor resolution. Consequently, much better results will be achieved by placing the focal point roughly leveled with the deepest part of the structure to be examined. Everything above this level on screen will be within the Fresnel zone and will therefore lie within the region of relatively high resolution. Failure to maintain the focal zone in the proper location while scanning will result in decreased resolution at the point desired. More than one focal zone can be used if the area of interest is larger than the single horizontal level. However, additional focal zones tend to decrease the frame rate. The frame rate refers to the speed in which the image regains clarity after the transducer is moved. For this reason, too many focal zones make the image harder to see when the transducer is moved rapidly. This image has 2 focal zones, but it's more common to use 1 focal zone. This image shows 2 focal zones at exactly the same level as the hyperechoic supraspinatus tendon shown in the middle of the screen. The gain increases or decreases the brightness of the image. The gain is typically set to provide the right contrast between the tissues being observed. This is often a matter of preference, but extreme values of high or low gain should generally be avoided. This image shows a scan of the transverse pollicis longus tendon with almost 100% gain. Due to an excess value for the gain, the entire image turns white. This results in loss of intra-tendon architecture visualization. Also, it obscures all hyperechoic details because everything turns white as well. This is the opposite. The level of gain has been decreased to almost 0%. Due to a smaller gain, the entire image turns dark. This results in loss of intramuscular architecture. Also, it obscures all hypoechoic details because everything turns dark as well. Improper gain levels result in less visibility of intrastructure architecture. This is an appropriate image where all different gray values are balanced out and where all different tissues are clearly visualized. You might wonder then, why is there a gain setting at all? Why don't all people scan with a preset gain percentage? The answer to that is that the sonographer has to adapt and optimize gain or brightness levels to each individual as it depends on body composition. The sonographer should also adapt and optimize the gain or brightness levels to each anatomical structure within a person. People who are new to musculoskeletal ultrasound tend to scan with a gain setting that is too high at the beginning. Please keep in mind the balance. The depth should be set at the level that places the region of interest in the majority of the screen. This is an inappropriate image because the region of interest is scanned with a depth of 1.5 centimeters. This results in a region of interest which lies at the bottom of the screen. Everything below the region has been cut off, which results in less visualization of the entire region. If the depth value is too low, the desired image could be truncated, or there can simply be insufficient contrast from surrounding tissues to provide adequate perspective. This inappropriate image shows a region of interest that has been scanned at a depth of 6 centimeters. Too much depth results in the desired image appearing too small, resulting in a loss of intra-architectural details. It also leads to wasted space. The sonographer could have used the entire screen to visualize the region of interest. This is a correct depth for the demonstrated region of interest. The transverse pollicis longus tendon is visualized at a depth of 2.2 centimeters. There is a nice overview in good contrast over the entire tendon and surrounding structures. Higher frequencies are used for the resolution of more superficial structures, and lower frequencies are used for better tissue penetration. There are no hard and fast rules regarding the precise frequency for each specific depth, as it can vary due to a number of factors, including tissue thickness. A general rule is that the highest frequency that provides adequate tissue penetration and visualization should be utilized. The wavelength and frequency of ultrasound are inversely related. For example, ultrasound of high frequency has a short wavelength and vice versa. Medical ultrasound devices use sound waves in the range of 1 to 20 MHz. In musculoskeletal ultrasound, this is generally between 6 and 18 MHz. Proper selection of transducer frequency is an important concept for providing optimal image resolution. High-frequency ultrasound waves, or short wavelengths, generate images of high resolution. Increasing the number of waves of compression and rarefaction for a given distance can more accurately discriminate between two separate structures along the axial plane of wave propagation. However, high-frequency waves are more attenuated than lower-frequency waves for a given distance. Thus, they are suitable for imaging mainly superficial structures. Conversely, low-frequency waves or long wavelength offer images of lower resolution, but they can penetrate to deeper structures due to a lower degree of attenuation. In other words, higher frequencies are used for superficial structures. Higher frequencies provide a higher resolution. Disadvantage of higher frequencies is that deeper structures cannot be scanned with high resolution. Lower frequencies are used for deeper structures. Lower frequencies provide a lower resolution. The image is of poorer quality. But the compromise is that it's capable, in contrast to higher frequencies, to scan these deeper structures. As an example, we could state that a median nerve in the carpal tunnel, a very superficial structure, is preferably scanned with 18 MHz and a hip joint with 6 MHz. Thank you for watching.